There are more than 3 million Australians who suffer chronic pain, with the latest National Pain Survey indicating a quarter of them would consider medical cannabis to help manage their symptoms. But doctors aren't writing the scripts for it. General practitioner and medical advisor to Little Green Pharma, Dr Jo Kostrich, joins me now. Dr Jo, what are the benefits of medicinal cannabis?
Yeah, good afternoon, Jerry. Medicinal cannabis was legalised in this country a bit over 3 years ago and has been used internationally for a couple of decades. Its main role can be in alleviating suffering from chronic pain. Now, like all painkillers, it's not going to work equally well for all people all the time, but we know that there is benefits in chronic pain, in insomnia, for people with anxiety, people with multiple sclerosis, some children with forms of epilepsy. So there are a number of roles for medicinal cannabis in certain people in certain situations. And we also know that the side effect profile is generally quite, really quite mild.
So why is it that GPs are so reluctant to prescribe it?
Yeah, look, that's a good question, Jerry, and I think it's also important to say that interest is growing compared to where we were a year and 2 years ago. A couple of problems. Number one, there hasn't been a lot of education around it. Medicinal cannabis does come with a bit of baggage. There's still some mythology out there about its use, and unfortunately, groups like the AMA continue to peddle what I would describe as misinformation, saying that there's no evidence. There is truckloads of evidence out there that's been done in North America, in Israel and in Europe, looking at its role. So I think a combination of misinformation and, a little bit of lack of understanding of its role. And there are some hurdles to prescribing. It's not just as simple as writing out a prescription, but, all of these can be addressed.
So what are you calling on doctors to do?
Look, it's really not for me to call on anything or anybody, but what this survey says is that patients, and there's millions out there with chronic pain, are saying we want this as an option. It's not the be-all and end-all, but they're saying to their doctors and to the public and to the government that, they want this to be an option that they can use in the right circumstances, and that, the powers that be should be, and this includes doctors, should be open to considering it.
So how can patients request this drug specifically, and is it affordable? My understanding is that it's really quite expensive. Maybe that's why it's not being prescribed.
There's no PBS or insurance coverage. The cost is something legally that can't be discussed. It's not cheap, it's not prohibitively expensive, but unfortunately legally that can't be discussed. Look, going to a doctor is not a self-serve. You can't sort of come in and say, I'll have a little bit of this and a little bit of that. But it is absolutely appropriate for people who have conditions where medicinal cannabis can help and where other treatments have failed, to say, is this an option for me, and open the discussion.
All right, Dr Jo, at the front of what I'm sure will be very popular in years to come. Thank you very much for your time.
Thanks, Jerry.